Now we'll welcome physician assistants Hilary and Adam Thompson. Welcome to the show today, guys. Well, actually, welcome back because you have been here before.
Thank you.
It's such a pleasure to have you here again. And I'd like to start off by reintroducing you to our viewers and telling them a little bit about your education and your background. So how about let's start with you.
Sure. We actually met in PA school at Pennsylvania College of Technology.
Really?
Yes. And so
I think I forgot that.
We've both been practicing family medicine here in Brunswick County for a little over 8 years now.
Wow, time went by fast.
It did.
I can't believe you guys have been here 8 years already. Yeah. So you both went to the same school? Yeah. So how long have you been in Brunswick County?
In total, well, we've been, like I said, we've been practicing here together for about 8 years, but I guess we've been here, what, about 10 years?
10 years.
Yep.
Wow. That's great. Now, Adam, you're both certified physician assistants, is that correct? So can you explain a little bit to our viewers about what that kind of means?
PAs, yeah, they're healthcare professionals. They're licensed in all 50 states. We can practice. We treat acute and chronic illnesses, write prescriptions, order and interpret tests. Pretty much can do anything a physician can do. We just work under the supervision of a physician.
Okay. And I understand that you guys treat patients of all ages. Is that correct?
Yes, we see newborns all the way up through seniors.
Oh, so you do start at newborns. That's great. Well, it's kind of nice to have the whole family, huh? You probably learn as much from the family members as you do your patient then.
Yes. Yeah.
Yeah, that's what Dr. Sieben was telling us, that they tattle on one another.
Yes, they do.
Well, let's talk about the services that you offer at Novant Health Seaside Family Medicine. Adam, do you want to tell me about that?
Yeah. Like you say, we offer pretty comprehensive family care, really. We treat, like I said, acute and chronic illnesses. We treat certain minor injuries, sprains, lacerations. We do all kinds of physicals, sports physicals, wellness physicals, things like that. We've got an on-site lab.
Oh, great.
So we can do blood work right there. We've got same-day appointments available for certain acute things. Hilary does a lot of women's health things, you know, like well women's exams, pap smears, things like that.
Oh, that's great.
Yeah.
Yeah. With colder weather upon us, I know many of us are preparing for cold and flu season. So do you have any tips for preventing it?
The best thing is to get your flu shot every year. That's the best thing you can do to prevent the flu. CDC recommends anybody 6 months or older gets a flu shot, and especially if you're have some chronic illnesses or immune system is a little bit decreased, then we especially recommend it. Generally, you know, as far as preventing cold or flu, typical things, you know, hand washing, sanitizing, common things like your phone, keyboard, things like that. You know, obviously avoid anybody that you know has the flu or is sick.
Like the plague.
Yeah. Don't eat or drink after anyone. Kind of basic stuff like that is the best thing you can do.
Yeah. Have you seen much flu already?
Not yet. Knock on wood.
Starting to see more colds.
Yeah. If somebody does have symptoms, what do you recommend?
Usually, if they're otherwise healthy, most people can fight off the cold or flu in 7 to 10 days. Usually we just do symptomatic treatment. Now again, if you've got chronic illnesses or your immune system isn't up to par, those folks are more likely to develop complications, require hospitalizations from pneumonia, certain complications that can occur. So they may want to seek treatment a little sooner, but in general it's good for anybody to get checked. You know, there's antiviral medicines that we can use, like Tamiflu, for people that have the flu.
Well, that's a good question, or that brings up a good question. How do I tell the difference between a cold and the flu? Because oftentimes I get it and I think, oh, I just have a cold, and it turns out it is flu, or vice versa. So
it's tough. Clinically,
great.
Yeah.
Great news.
I mean, a lot of the symptoms overlap. You know, the sore throat, runny nose, cough, stuffy, not feeling great, fevers and chills. Typically the flu you're going to get more profound fatigue, just feeling completely run down, muscle aches, joint aches. People say they've felt like they've been hit by a truck, typically, things like that. But there's a lot of overlap. We've got the ability that we can do a flu swab in the office. It's a nasal swab that we can get the results right there if there's some question. But there is a lot of overlap. Typically, the flu is a lot worse. It's kind of like the common cold on steroids. It's an easy way to think of it.
That's a great description. Yeah. And I have felt before like I've been run over by a truck, so I know what you're saying. Hilary, I understand that you also have a particular interest in skincare?
Yes.
Tell me about that.
I actually used to work in dermatology for a couple years prior to working in family practice, so I actually do some dermatology, you know, in practice.
Oh, okay.
But as far as I can offer some good winter time skincare tips, one of the best things I tell people is you're better off using a body wash as opposed to a bar soap. Bar soaps are really irritating and drying to the skin. You also want to get in the habit of moisturizing your skin, and actually the best time to do that is within 3 minutes after bathing. And one of the best moisturizers, actually, believe it or not, is Vaseline, regular old Vaseline.
It's so greasy.
It is, but if you put it on right away after bathing, your skin will absorb it.
Really? I'm going to try that. I didn't know that. That's really helpful. So before we wrap up, how about telling our viewers how they can contact you and make an appointment with either of you?
Sure, they can just call the office and speak with one of our staff. The number is 910-575-3923, or they can schedule online through MyChart.
Oh, yes, that's right. You guys are on MyChart.
Yeah.
Forgot to say that. That's a great tool. I love MyChart. I'm on it, and I think it's great. So, well, thank you so much for being here today. It's been a pleasure to see you again.
Yes.
Yeah, it's been a while since you've been here. So I look forward to having you back real soon.
Sounds good. Thank you so much.
Thanks.
Great.